professor, physician, epidemiologist. I am Dr. Sri Banerjee. Hello everyone, I'm Dr. Sri Banerjee, core faculty for the College of Health Sciences and Public Policy at Walden University with a joint faculty appointment at Ross University School of Medicine. And I'm happy to announce this morning I actually got the good news from the primary author that this paper that we've been working on for years, literally, the data was collected in 2017, 5 years ago, was finally published, and the title of that journal is Prevalence and Risk Factors of Obesity Among Workers in the Oil and Gas Industry of the Niger Delta region. So this was a study that was conducted in Nigeria, and a very important study, field-based study on a population in occupational health that is not oftentimes that we don't have access to, especially in low and middle income countries, where the focus until now, before the epidemiologic transition, has been on infectious diseases. So looking at chronic diseases in low and middle income countries is definitely refreshing and provides insight, unique insight. So I ran the analysis on this paper and provided kind of the framework and guided the research, and we all put our minds together and had created this. And of course, like the vast majority of just processing everything. Thanks. I wanted to thank Dr. Anig Bogi, Charles Anig Bogi, who was also one of my former students and graduates. So obesity prevalence, this is among oil and gas workers. Why is it a problem? Well, it's becoming more of a problem among adults of working age. So this is why it's important not only to evaluate obesity within the community, but also understanding how obesity is affecting within the workplace. And so we provide the definition of obesity and then go into just talking about some of the methodologies that were used, and looking at some of the data analysis that was conducted. Obesity was turned into a binary classifier, and then there were continuous variables that were included into this, and then multiple statistical tests were run together in order to create the analysis. So a logistic regression test actually was run. So here's the logistic regression analysis, and just looking at some of the p-values and the associations. And so what was found in this cross-sectional study was that the overall prevalence of obesity in workers of the Niger Delta region was around 50%, which is pretty high, and also higher than the general obesity prevalence rate of only 5.5%. And of course, there might be some underreporting and underrepresentation of this, but the high prevalence rate was hypothesized to be due to reduced physical activity and unhealthy dietary factors, and a long off-duty shift. So sedentary life, and maybe encouraging a more healthy lifestyle within the gas company. This is through Shell and oil gas employees. This can go a long way and promote employee well-being. So just in conclusion, obesity is a multifaceted global public health problem which requires understanding from many different approaches and aspects. Occupational health is one of those, but understanding how lifestyle choices and then also socioeconomic status of the individual and some of the upstream factors that affect social determinants of health are also pertaining to the condition of obesity. So just here we end with some key points, some take-home messages, and also understanding of what this study adds, providing another estimate of obesity prevalence and some other parts. So I wanted to thank everyone who was part of this project, and just wanted to express just celebration for a nice article being published. Thank you for listening.